Hi, Dr. Brian McGee, physical therapist with Rexercise. So today's video is my phase 2 home exercise program for my patients who have recently undergone an ACL reconstruction. So this is really week 2 post-op, and this is the second in a 5-part series on rehab after an ACL reconstruction. So in this phase, we'll get a little more aggressive with our range of motion, a little more aggressive with our strengthening. Depending on the circumstance, we'll start to bear some weight, we'll start to walk around. And as in the last video, stay tuned to the end where I'll go through the real key points to keep you on track. This exercise is working on both knee bending range of motion and our quadricep muscle function, and I guess as well as our knee straightening. So with the band around kind of the ball of the foot, heel on the stability ball, you're simply going to apply some tension in the band, pulling the knee into some bending. Pull until you feel a stretch, hold for a few seconds, then straighten against the resistance of the band, get the knee all the way straight, hold for a moment, come back. So now the tension in the band is pulling the knee into bending, we got a stretch, then you push against the tension in the band to engage that quadricep muscle. Back and forth 10 to 20 times. Our next exercise is going to start to work on our hip muscles and our hamstring muscles. Now for those who had a hamstring autograft, in other words, the surgeon used part of one of your hamstring tendons to reconstruct your new ACL, you can't do this exercise yet. You won't be able to do hamstring strengthening until somewhere around 8 to 10 weeks plus post-op. So, but for those who didn't have that, we want to start strengthening the hamstring muscles. And so here's one of our first efforts to do that. We're simply going to clench the butt muscles together, lift the hips up, hold for a moment or two, come down. Clench the butt muscles, lift up, come down. Up and down 10 to 20 times. Before we do the next exercise, I want to remind everybody, click those like and subscribe buttons. Leave a comment if you find this content helpful. So our next exercise is simply a mini squat, about a half depth squat. So for those that have a weight bearing restriction, you've had a meniscus repair, you still have to be in the brace, you can't do this yet. But for others, we want to start pushing the weight bearing a little bit as our range of motion improves and especially as our quadricep muscle function improves. So you'll want something for support, back of the chair, countertop perhaps, and simply half squats, 20 to 25 times. And you can roll that right into the next exercise, which is simply a calf raise. Again, 20 to 25 repetitions. This exercise works on our quadricep muscle function as well as our knee extension range of motion. If you're still having trouble getting to full knee extension, keep up the extension stretches from our phase 1 video. So in this exercise, you simply secure some rubber band on, in this case my bench. You can shut the other end of the band in a door, step back until it's pretty tight. And of course, if you have any weight bearing restriction, you can't yet do this exercise. But for those that don't, here's what you do. You simply let the tension in the band bend the knee a bit, and then you straighten the knee against that tension, clenching your thigh muscle, hold 5 seconds, relax. So it's basically the quad set that we were doing in phase 1, but now in standing with some weight going through the knee, which stimulates a little more muscle activity. So again, a 5-second hold, 20 times. So that's my phase 2 or week 2 post-op home exercise program for my patients who have recently undergone an ACL reconstruction. So I mentioned in the intro some key points to keep in mind to kind of give you a context of where you want to be at this stage of recovery and to keep you on track. So number 1, we really want full knee straightening or extension by the end of week 2. That's pretty important. We'll want to get to a full knee flexion or bending in about another week. Now, what does full mean exactly? So with straightening, extension, we want to be within 2 degrees of the opposite side. With bending or flexion, we want to be within 5 degrees of the opposite side. And why is that important? 2 main reasons. Those who don't achieve full range of motion are at more risk for re-tear, and number 2, at more risk for developing arthritis in that knee, neither of which we want. Now, for those of you who have had a meniscus repair, in addition to the ACL reconstruction, there are some ongoing restrictions. So for simple repairs, you can put as much weight on that leg as you want, as it's not painful, as long as the brace is locked in extension. It has to be locked in extension with all weight bearing. For those who have complex tears, still no weight bearing. And you'll know that from your surgeon, and your therapist working together will be aware of those restrictions. But keep those in mind. Swelling control. We still have to continue the swelling control. It only takes about 30 milliliters of extra fluid in that knee capsule to trip the reflex that causes that quadricep muscle to shut down a bit. So you won't get full quadriceps contraction until that swelling is resolved. So continue with the ice, the compression, the elevation. So now in our next phase, we'll get a little more aggressive with our range of motion for any deficits that might remain. We'll get a little more aggressive with our strengthening, and we'll start some balance work for those who don't have some kind of weight-bearing restriction. So we'll see you in phase 3.